Hello and welcome everyone. We are Group 1 from NCM 109. Today we're exploring a critical topic in maternal and child care, Hmole, or we say in Ilocano as Sikog Adakas.
My name is Alex and we'll discuss how a hydatidiform mole, a type of abnormal pregnancy, can impact mothers and children and why early detection is essential.
I'm Jiro. We'll explain what a molar pregnancy is, its clinical features, and the diagnostic process.
Hi, I'm Santi. I'll cover the management and treatment options available with a focus on the nursing care aspects.
And I am Maxime. I will help connect these clinical insights with our local cultural context and introduce our supplemental slides that offer a quick reference on key points.
A hydatidiform mole or molar pregnancy occurs when an egg is fertilized abnormally. In a complete mole, an empty egg is fertilized, often by one sperm that duplicates, resulting in no fetal tissue. In partial mole, some fetal tissue forms but is non-viable. In our language, Sikog Adakas means something really harmful, which aptly describes a potential dangers if this condition is not managed.
Molar pregnancies may show unexpected vaginal bleeding, severe nausea, and an enlarged uterus. Elevated HCG levels are also a key indicator. Ultrasound typically reveals a snowstorm or grape cluster pattern in the uterus, distinguishing it from a normal pregnancy.
Diagnostic tests confirm the condition through elevated HCG levels and the characteristic ultrasound findings. If untreated, a molar pregnancy can progress to an invasive mole or, rarely, choriocarcinoma. This reinforces the need for early detection and prompt intervention.
Gestational trophoblastic disease or Hmole is defined as an abnormal proliferation and degeneration of the trophoblastic villi. As these cells generate, they become fluid-filled vesicles appearing like a clusters of grapes.
Gestational trophoblastic disease or Hmole is an abnormal condition where trophoblastic cells grow uncontrollably, forming fluid-filled vesicles instead of a normal placenta. These vesicles reassemble and prevent the development of a healthy pregnancy. Since the placenta is important for fetal growth, an Hmole leads to pregnancy loss and requires immediate medical intervention.
Key risk factors include low protein intake, women older than 35 years old, and a specific blood group combination or blood group A marrying group O. Certain factors increase the risk of developing an Hmole. Women with a low protein diet may lack the necessary nutrients for healthy placental development. Age is another factor. Those over 35 have a higher risk of abnormal cell growth. Additionally, research shows that women with blood type A who conceive with the blood type O partner may have a genetic predisposition to this condition.
In a complete mole, all trophoblastic villi swell and become cystic. If an embryo forms, it dies very early, 1 to 2 mm in size, with no fetal blood present. This is an empty ovum scenario, resulting in the snowstorm appearance on ultrasound.
In a complete mole, all the trophoblastic villi swell abnormally, creating a mass of fluid-filled cysts. No viable fetus develops because the ovum is empty. It contains no maternal DNA, so when fertilized, only paternal chromosomes replicate. This results in what we call the snowstorm appearance on ultrasound, where the uterus is filled with the dense, abnormal tissue rather than a developing baby.
In a partial mole, some villi develop normally while others are swollen and mishappen. A macerated embryo of about 9 weeks might be present with fetal blood. This type has 69 chromosomes and rarely progresses to choriocarcinoma.
Unlike a complete mole, a partial mole contains both normal and abnormal placental tissue. A malformed embryo may develop, but it will not survive beyond early pregnancy. This condition occurs when an egg is fertilized by 2 sperm, leading to 69 chromosomes instead of the normal 46. Although it is less likely to turn cancerous compared to a complete mole, medical treatment is still necessary.
Assessment includes noticing a rapidly expanding uterus, a positive urine HCG test with levels around 1 to 2 milli-international unit per milliliter, marked nausea or vomiting, and ultrasound findings of a dense snowflake pattern with no fetal heart rate and dark brown vaginal bleeding around 16 weeks, which is often an early sign of preeclampsia. Management involves suction curettage, pelvic exam, chest x-ray, and regular serum HCG tests every 2 weeks until normal, then monthly for 6 months, and every 2 months up to 1 year. Patients should use oral contraceptives, and for malignant cases, methotrexate is a drug of choice, with actinomycin added if metastasis occurs.
These supplemental slides offer a concise overview of the condition's definition, risk factors, types, assessment, and management strategies.
Treatment typically involves surgical removal of the molar tissue via suction curettage. For high-risk cases, chemotherapy might be needed to prevent persistent trophoblastic disease. After treatment, patients are closely monitored with serum HCG tests to ensure complete resolution of the condition.
Nursing care is crucial in managing Hmole. Nurses monitor vital signs, educate patients on recognizing symptoms, and ensure that follow-up appointments are maintained. In our community, nurses extend their care beyond the hospital. Just as Sicognadacus warns us of danger, our nurses remain vigilant and provide culturally sensitive guidance.
So now, meet Mrs. Reyes, who presented with unexpected vaginal bleeding and severe nausea early in her pregnancy. Her uterus was larger than expected, and her HCG levels were extremely high.
An ultrasound confirmed the characteristic rape-like appearance, leading us to schedule an immediate suction, curettage, and regular follow-up tests.
This coordinated team effort not only saves lives but also preserves the future reproductive health of our patients.
To summarize, a HITA-PD4 mole, our mole is an abnormal pregnancy that can be life-threatening if left untreated. Early detection and prompt intervention are essential.
By blending modern medical practices with our cultural perspective, using this phrase Sicognadacus, we make this topic both informative and relatable.
We hope this presentation has deepened your understanding of Hmole and its significance in maternal and child care.
We would like to thank our instructors and all the sources that help us develop this comprehensive presentation. For further details, please refer to the references on screen.